escape. Informant is patient's father, who is 41-year-old male, illiterate, living with the patient throughout the illness, and the patient himself. History given is clear, consistent, coherent, given in a chronological order, corroborated among both informants. History is reliable and adequate. Chief complaints: low mood since past 1.5 months, disturbed sleep since past 1.5 months, decreased appetite since past 1.5 months, and episodes of Gabrahat since past 1 week. Onset of the illness is insidious in onset. Complaints are insidious in onset. Course is progressively deteriorating, and duration is 1.5 months. No predisposing factors could be elicited. No perpetuating factors could be elicited. Precipitating factor: death of a close friend's father. HOPI: patient was apparently well 1.5 months back, performing his day-to-day activities like waking up at his usual time in morning, then take bath, read namaz, eat his breakfast, after which he would go out to play with his friends and sleep in the afternoon. He would spend most of the time outside with his friends and at home with his family members, actively interacting with them as his winter vacations were going on. But one day, after the demise of his close friend's father, he started to feel low, which would persist throughout the day with no diurnal variation. But gradually, as the days passed, he started experiencing that his mood would worsen during the night. His father noticed he started to appear distressed, and on asking, he would reply, "आजकल मन दुखी रहता है जब से सलमान के अब्बू का इंतकाल हुआ है." He also started to develop decrease in interest in spending time with his family or relatives. He would confine to himself and would avoid going out to play with his friends, which he enjoyed doing earlier. He started to appear very slow in his movements. He would take a lot of time to do any kind of work, like if his mother would send him to buy something from a shop nearby their house, he would take more time than usual. Gradually, he started to lose interest in routine activities like bathing or changing clothes daily, unlike earlier. As the days passed, his sleeping pattern was also disturbed. Earlier, he would sleep for 6 to 7 hours per night and sometimes also in afternoon, but now he would sleep only for 4 hours per night. He would go to bed around 9 p.m. and would have difficulty in onset of sleep. He would keep on lying in bed for 3 to 4 hours, thinking about his future, which would appear bleak to him with no hope of anything good happening to him. He would be worried that he took admission in school at a later age than his other friends, and his schoolmates are younger than him. Even if he would go to sleep, he would get up intermittently and would keep on lying on bed and could not go back to sleep again. He started to wake up 1 to 2 hours before his usual waking up time and would feel lethargic and fatigued after waking up in the morning. Gradually, his family members noticed that he would appear thin and weak as his appetite decreased. Earlier, he used to consume 3 to 4 meals per day, but now he was consuming only 1 to 2 meals per day and would not finish his meals and would go back to his room. 1 week prior to the admission, while he was sitting in his room alone, he heard about the demise of his neighbor, one of his neighbor, after which he started experiencing shortness of breath, palpitations, choking sensation, and feeling of impending doom. He called his parents, and when they saw him, they immediately took him to a nearby hospital where he was managed symptomatically and was given oxygen support. He then became normal after 15 to 20 minutes and was later investigated for the same, but all his investigations came out to be normal. After 3 to 4 days, he had similar episode wherein every time he was taken to a hospital and relieved after giving oxygen support. Gradually, for past 3 days, the frequency of these episodes increased, wherein he used to have 2 to 3 episodes of ghabrahat and shortness of breath per day and became fearful of these episodes. These episodes would start with a dry cough as reported by the patient, which was followed by rigidity of both upper and lower limb bilaterally. bilaterally, sweating, dry mouth, epigastric discomfort, and palpitations. After noticing increase in intensity and frequency of these episodes, his parents decided to get him admitted in a private hospital in Dehradun. He was earlier admitted in pediatric ward and was later referred to psychiatry department after 2 days of admission for further evaluation and management. During his stay in pediatric ward, he reported heaviness in head most of the time of the day, which would get relieved after taking medication. After being admitted in psychiatry ward, patient reported improvement in his complaints. So low mood since past 1.5 months, disturbed sleep since past 1.5 months, decreased appetite since past 1.5 months, and episodes of ghabrat since 1 week. Episodes of chronic movement, rigidity. Yes, sir. They were doing sir, during the episodes of ghabrat, prior 1 week prior to the admission, sir. After he heard a news about demise of one of his neighbors. Rigidity was present there. Sir, in both the bilaterally, both upper and lower limb, as reported by his father. How long it lasted? Sir, till almost 15 to 20 minutes. What were the associated features with that? What were the sir, sweating palpitation, dry mouth, epigastric discomfort. So patient was conscious at that. There's one episode of rigidity. Sir, there has been similar episode 4 years back. Yes, sir. Only one episode of rigidity this time. Sir, actually, in past, sir, 4 years back, there was similar episode. Yes, sir. He told me that 15 to 20 minutes के लिए जब घर में थे तब होता है और लेकिन सर वैसे जब वो हॉस्पिटल जाते हैं जब तक ऑक्सीजन सपोर्ट नहीं मिलता तब तक वो एपिसोड लास्ट करता है रिजिडिटी का सर एक है नहीं सर रिजिडिटी का सर एक एपिसोड 15 से 20 मिनट कैसे लग जाएगा सर इन्होंने अंदाजे से बताया तो उससे पहले कितनी देर पता नहीं कि हॉस्पिटल पहुंच गए और शुरू में कितनी देर पता हॉस्पिटल मतलब जैसे शुरू हुआ वैसे ही गए तो तो जैसे ही 2 मिनट में एपिसोड हुआ है बिल्कुल सड़क के गेट पर पहुंच के ले जाने लगे जैसे उसको मतलब उसको हॉस्पिटल ले शुरू होने से लेके हॉस्पिटल लेके जाना सर 45 minutes. What about the rigidity? Means at 15-20 minutes. The best, the father is illiterate, right? Yes. So how do they know how long the period lasts? तो ये कैसे करेगा करोगे 15 मिनट कितने देर लास्ट होते हैं वो तो 10-15 मिनट जो दिमाग में है 15 से 20 मिनट कितनी देर होते हैं आपको आइडिया है रिलेटेड फर्दर को तो you need to clarify you need to ask them कि अभी इंटरव्यू लेके कितने देर हो you need to be sure इनको टाइम के कितना आइडिया है तो you need
वो तो ये नहीं कि 1 घंटा तक लगा सकते हैं, 1 घंटा आएगा तो कितने लोग ये तो 1 घंटा हो गया बात करते रहते कोई बात नहीं करते इसी तरह पे 20 मिनट्स का आपको आइडिया है नहीं है पर हॉस्पिटल जब तक देर कर देती उस टाइम पे बात कर रहा नहीं कर रहा पेशेंट
सर उस टाइम बात कर रहे थे
हाँ,
लेकिन
दे
शॉर्ट
रहे थे।
यस सर तो सर पहले कफ की कंप्लेंट स्टार्ट हुई उसके बाद शॉर्टनेस हो रहे और उसके बाद सर ये पैल्पिटेशंस स्वेटिंग एपिगेस्ट्री यस सर उनके फादर
क्या कर रहा था what is it but मेरे को इन्वर्टर से देना होगा कौन सा डॉग पहले जाएगा क्योंकि मेरे को एक अदर डॉग बस बस टू है लेकिन मतलब हां और काम करने का सकता है सो इस विल बी कॉल इट सीरीज कौन सा it started maybe yesterday maybe I don't know evening or at night so I'm not able to tell you so still should be incident also when we call it
सर विद इन 48 आवर्स अगर हो रहा है सर तो एब्रप्ट बोलते हैं 2 वीक्स के अंदर हो रहा है अगर तो एक्यूट और उसके बाद हो रहा है सर सीडीएस
और भी इसी तरह ऑप्शन होता है मतलब 3 हो गया मतलब एब्रप्ट और इसी तरह का ऑप्शन हो सकता है एग्जांपल बताओ क्या बोलेगा पेशेंट को
सर कल रात को अचानक से एकदम से दिक्कत शुरू
कल रात को
दिक्कत शुरू हुई परेशानी
हाँ कल रात को कितना अचानक क्योंकि मैं आज हॉस्पिटल में मैं तो व्हाट इज दिस वन
सर एब्रप्ट
ठीक है when patient will say this is acute concept
सर अगर प्रॉब्लम सर स्टार्ट हो गई थी लेकिन इतनी ज्यादा नहीं हुई कि पेशेंट को हॉस्पिटल आना पड़े और सर वो विद इन लेकिन 2 वीक्स आ गए लेकिन 48 आवर्स के बाद कंप्लेंट्स के साथ आया
so मतलब जब से दिक्कत शुरू हुई वो पीरियड और हॉस्पिटल लेके आने का पीरियड 40 आवर्स से ज्यादा और 14 डेज से कम होना चाहिए तो मान लो कि मेरे को तो कहने आया मैं तो मेरे को तो बंद रखा है 6 महीने में घर में ही है तो बाबा जी को दिखा रहे हैं किसको दिखा रहे हैं तो झाड़ू चला रहे हैं इसके लिए हो गए हैं आज हॉस्पिटल आए हैं so this is not a good option but तो इसको टाइम टेकन फॉर इट either 3 moments and 2 moments it's a definition of definition of then कौन सा टाइम टेकन फॉर द सीरियल फॉर द स्टेट टू द सीरियल मार्केट आपके केस में क्या है अच्छा अभी सीरीज करने की और मैनुअल रिकॉर्ड कंसीडर होता है बड़ी सारी कुछ ठीक है टाइम में मतलब और व्हाट इज द कॉन्टेंट is what is plotting of it. This is like a problem. This is
So chronic more than 3
but it's
7.5 minutes.
one and a half month what? 1.5 month history. Thank you. Thank you. मेरा हिस्ट्री आप सेंड करना चाहिए उसको रख लिया
Sir, insidious.
सारे पहले पढ़ेंगे कितनी देर में क्या है कॉन्सेप्ट कैसे नहीं बताओ और पूरा कॉन्सेप्ट अभी कितने मंथ का हिस्ट्री है
The total is 1.5 minutes.
बताओ आपको क्या से कर रहा हूं और एंड करके यार 1.5 मंथ का हिस्ट्री है तो 1.5 मंथ कॉन्सेप्ट कैसे हो गया बता दो ये कॉन्सेप्ट कैसे क्या डिफरेंस है कॉन्सेप्ट 1.5 मंथ को 3 साल से तो दुनिया है मैंने कॉन्सेप्ट क्या 3 साल कॉन्सेप्ट मैं आ गया
क्यूट होगा क्योंकि वन पीस से इसका शॉर्टनेस ऑफ रहता है
लेकिन वो तो ये अलग कॉन्सेप्ट तो अगर वो एक ही चीज कर रहे हैं आपका भी
पेशेंट लेकिन पेशेंट ने सब्जेक्टिवली रिपोर्ट करा कि 1.5 मंथ्स उसका मूड लो रहता है तो सर
वो हॉस्पिटल 3-4 साल वाला था या हॉस्पिटल क्या 6 दिन में आ जाता सीरियस डेमेज मिली अच्छा मेरे को वैसे बताओ कॉन्सेप्ट अगर सीरियस कॉन्सेप्ट है तो पेशेंट क्या करेगा इस केस में बोलो कि ये सीरियस है ऐसा तो मेरे को एक कॉन्सेप्ट का पेशेंट क्या बोलेगा कि एक कॉन्सेप्ट into this water क्या होगा पेशेंट क्या बोल रहा होगा आपको क्या समझ लेना है जो वो बोलेगा मतलब इसको मतलब लीव ये बात करने का क्या तो काइंड ऑफ करना नहीं है कंफर्टेबल नहीं है एक्सपोजर ठीक से 2-3 दिन में वो 3 दिन में मतलब why you don't get अगर तो क्या है
एक दिन से
कल ठीक था आज दिल्ली का कैसे करता है ये 10 दिन पहले तो ठीक था लेकिन 10 दिन से एकदम ही इरिटेट करने लग गया दूसरे के बारे में 10 दिन पहले ठीक था 10 दिन पहले ही मतलब एक ना एक ना मतलब ठीक था लेकिन एकदम से एक दिन पहले ही ब्लू दास का एक दिन पहले का एक दिन बात नहीं करती एक दिन पहले का मतलब रट लिए इज द रट ऑफ सर थोड़ा मतलब कि ड्यूरेशन इतना सा कितना है कॉन्सेप्ट का मतलब नॉन मॉडल स्टेट की बात कर रहे हैं अब मेरे को सीरियस बताओ कहाँ से बता रहे हैं कैसे? कोई डाउट है?
also science.
तो ये लिखा हुआ है कौन? तो और मतलब ऐसा लेवल में क्या करो मतलब तुम पर देख अगर से देख कुछ पे कुछ देख यार कौन सा नॉलेज चेक पहले लेवल को आप ये वो और पे गए तो तुम्हारे लेवल वैसे कर करते हैं चाहे ठीक भी हो और मतलब ऐसा नहीं कि तुम बिल्कुल ही कोई वो बुक रेफर कर दो चाहे बिल्कुल सी होगी मैं तो रोलर नेट की डिस्प्ले सर तो वो नहीं मतलब तुम्हें तो बेसिक बुक ही रेफर कर सकते हो मतलब सारे वेबसाइट कैपिटल ऑक्सफोर्ड फिश सिम्स आईसीडी डीएसएम स्टोर्स चलो कुछ डाउट है क्या ठीक है
Sir, negative history. There is no history of helpless.
बायोलॉजिकल फंक्शन बोला था लास्ट में वैसे एप्लीकेटर की उसमें डाउट कर लिया मैं सिर्फ नेट में तो नेट और ज्यादा वेरिंग करना नहीं पता था नेट और ज्यादा नहीं पता था तो क्या बिल्कुल एक से मतलब सिर्फ हो गया वो ठीक है अपना काम कर रहा था नहीं कर रहा था कितना आपको पता
Negative history. There is no history of any feeling of helplessness, self-harm thoughts or attempts. There is no history suggestive of any specific developmental disorder of speech. There is no history of any motor incoordination. There is no history of suggestive of any reckless behavior and breaching of rules. There is no history suggestive of breaks or interpolations in train of thought. There is no history suggestive of significant head injury. There is no history of any substance use. There is no history of suspiciousness, self-monitoring, self-smiling. There is no history of hearing voices not heard by others and seeing things not seen by others. There is no history of over-talkativeness, tall claims, decreased need for sleep, racing thoughts, increased libido, over-familiarity, over-religiosity, or over-grooming. There is no history suggestive of any compulsive acts. There is no history of thoughts being introduced into or taken away from mind by an external agency against the will, own thoughts being heard aloud or being known to others against the will. Yes. Treatment history. There is no significant past treatment history. Past history. There is history of similar episodes in past 4 years back, for which patient was admitted in pediatric ward of Shri Mahant Indresh Hospital. Later developed fever during his stay and diarrhea and was diagnosed with malaria. And during that episode also, shortness of breath relieved after patient was given oxygen support. There is no history of any other significant general medical condition, or there is no history of any other previous surgical procedures. Family history. Patient is third in the order of six siblings of a non-consanguineous marriage. There is history of demise of elder brother uh, at the age of 8 years due to febrile seizures. Patient lives in a nuclear family with his parents, grandmother, and siblings. Patient has a cordial relationship with other family members. There is history suggestive of abnormal body movement associated with clenching of jaw and feet, fists, and shortness of breath in paternal cousin sister, which was not associated with any frothing from mouth, tongue bite, or urinary or fecal incontinence. There is history of hypertension in mother. Economic head of the family is father, emotional head of the family is mother. Patient is closest to mother since childhood. Family is supportive towards the patient and has sympathy towards his illness and understands importance of regular follow-ups and compliance. Birth history, full term normal vaginal delivery, home birth, cried immediately after birth, no complications perinatally, birth weight was 3.5 kgs, no history of fever, cyanosis, prolonged jaundice, breath holding spells, abnormal body movement, or admission to NICU, no antenatal exposure to X-rays or toxins, no history of antepartum, postpartum complications. All developmental milestones were achieved as per age, completely immunized as per national immunization schedule to the best of the parents' knowledge. No history of any maternal deprivation. Childhood history. Patient was born in Rampur, UP. No history of being bullied by other children, temper tantrums. No history of hyperactivity, inattention, repeatedly bullying other children, stealing, lying, setting fire, nail biting, thumb sucking, wetting, or stuttering during childhood. Would share his toys with his brother and other children as well. No home atmosphere in childhood and adolescence. No history of broken home, desertion by parent, step parent, adopted sibling. Scholastic and extracurricular activities. Started schooling at the age of 8 years. Would actively participate in cultural events and sports in school. There is history of change of school 2 years back from government college to private, government school to private school. Sexual history, patient attained puberty at the age of 13 years of age. Patient did not report of any history of masturbation or sexual intercourse. Forensic history, no history of arrest, no history of any impending legal case. Temperament, activity level as reported by the parents was normal. Attention span and persistent. When his activity would be interrupted, he would forget about it. Approach withdrawal. When he would meet children of his age for the first time, he would go spontaneously talking to them. Adaptability would get mixed and get friendly with his with children of his age. Distractibility, low distraction, intensity of reaction could not be assessed. Threshold of responsiveness was high threshold. Quality of mood was happy. Rhythmicity was predictable. Impression easy. General physical examination, ectomorphic built male, body weight 43 kg, height 161 centimeters, BMI 15.4 kg per meter square. Identity. Yes. Sir, 15.4. Identification mark, mole of 0.5 mm on neck and mole of 0.6 mm on lower back. Pallor, icterus, clubbing, cyanosis, lymphadenopathy, edema, dehydration, absence. Systemic examination, respiratory. On MSc, general physical appearance and behavior, ectomorphic built male entered room unaided, accompanied by father, sat on the chair provided and returned the interviewer's greeting with drooped shoulder facing downward, wearing a shirt, pant, and shoes appropriate as per his surroundings. Hair groomed, dirty nails, clothes appeared clean. Appeared as per his gestated age, in touch with his surroundings. Eye contact was initiated and sustained. Attitude was cooperative. Rapport established with ease. Psychomotor activity was normal. Speech intensity was audible. Tone was monotonous. Quality was soft and reaction time was increased. Speed very slow. He is speaking only when question asked, relevant, coherent, and goal directed, but productivity of speech was decreased. Cognitive functions oriented to time, place, and person. Attention was arousable and sustained. He was able to do digit forward span up to 5 digits and digit backward up to 4 digits. Serial subtraction, he was able to do it up to 3 times. Memory recent intact, remote intact. रिसेंट मेमोरी में सर क्वेश्चन था कि कल खाने में क्या खाया था, रोटी सब्जी दाल खाई थी, सुबह नाश्ते में क्या खाया था, चाय और ब्रेड. रिमोट स्कूल जाना कब से शुरू करा रहे हो?
कल खाने में याद करना लेके आओ। थोड़ी सी जैसा बहुत जनरल हो गया और सारी फाइल भी जनरली इंडियन साइड पर थोड़ी सी सारी नहीं यार वो कर देगा क्या समझ करेंगे
ठीक.
क्या स्थिति क्या डालनी है
रिमोट मेमोरी स्कूल जाना कब से शुरू करा था? 8 साल की उम्र में. न्यू लर्निंग एबिलिटी, sir, words were given badal gaadi fool, which he was able to repeat after 5 and 10 minutes. Higher cognitive function, general fund of information. हमारा फेफड़ों का क्या काम होता है? सांस लेना. उत्तराखंड का सीएम कौन है? पता नहीं. यूपी का सीएम कौन है? पता नहीं. Sir, he was able to do simple verbal calculation. 20 minus 370, 20 to 500, and 100 divided by 425. Abstract ability, he was not able to tell any proverbs. Question asked for, नाच न जाने आंगन टेढ़ा नहीं पता, एक अनार 100 बीमार की नहीं पता, बंदर क्या जाने अदरक का स्वाद नहीं पता. But was able to tell 3 similarities. But was able to tell 3 similarities and 2 dissimilarities between banana and apple. Mood was dukhi hai. Affect quality was depressed. Intensity shallow. Range normal. Reactivity normal. Thought stream normal. Form no formal thought disorder. Content ideas of hopelessness and worthlessness, and possession was self. Perception was normal. Test judgment was intact. क्वेश्चन आज वाज, वार्ड में किसी का फोन गिरा मिलेगा तो क्या करोगे? वापस लौटा दूंगा स्टाफ को. भूकंप आ जाएगा तो क्या करोगे? बाहर भागूंगा. सोशल जजमेंट was impaired. Isolated behavior. Personal intact. जब अस्पताल से छुट्टी मिल जाएगी तो क्या करोगे? पढ़ाई करूंगा और आगे चल के डॉक्टर बनूंगा. Insight was grade 3. Patient was not aware of his illness. Then he was psychoeducated. Then he attributed the cause of his illness to the demise of his friend's father. Patient Master X, 17-year-old male, unmarried Muslim, lives in a joint family, studying in 9th standard, resident of Rampur, UP, third in the order of 6 siblings, belonging to lower socio-economic status, with no significant general medical and medical history, with no significant general medical condition in family members, with history of similar episodes of ghabrahat and shortness of breath 4 years back. Patient presented with complaints that are acute in onset, continuous, and deteriorating in course. History given is reliable and adequate, with complaint of low mood since past 1.5 months, disturbed sleep since past 1.5 months, decreased appetite since past 1.5 months, episodes of ghabrahat since past 1 week. General physical examination was grossly within the normal limits. On MSc, speech was decreased in tone, volume, intensity. Reaction time was increased. Speech productivity was decreased. Mood dukhi hai, affect depressed. Thought content, ideas of helplessness and worthlessness. Social judgment was impaired, and insight is grade 3.
diagnosis?
Sir, according to ICD-10, sir, severe depressive episode without psychotic symptoms. First also.
So what about the rigidity? What was that? Was that part of the session? That's sort of rigidity.
So it can be part of sir panic attack.
Before we
No, sir. During the episode of shortness of breath.
Rigidity guide for time for
Yes, sir. सर पहले pediatrics में थे वहाँ से transfer
I asked him, he was here for 14 days, 13 days.
yes sir
In our
hospital
he was working in pediatrics, he was admitted, he was going to be discharged. He was sent to the body and seeing his condition. And also he was being dissociated. So I asked him to appreciate. You were the one who got the reference. So he did the reference and then he said that it was a very depressed during the examination. So he evaluated on the cursory class it appeared to be like this one. So I asked them to get transferred to us, and then like they had discharge already and it was transferred to us. So just to confirm that we were in this case. Basically, the most previous was that he was twice, like once for 2 weeks, and the next day also he was in the medicine department for such a long period. Even on the considered physical things.
but I think
Yeah, the medical
and without considering क्या क्या फीचर्स पेट में है क्या क्या कैरियर and what is there or not.
sir 3 typical features sir depressed mood and loss of interest and enjoyment and sir easy fatigability
तो ये फीचर्स है आपके
yes sir
आपके प्रोग्रेस करने और उसके आपके पास दिया था लॉस ऑफ इंटरेस्ट you mentioned that he was to follow market and this would take longer than normal and then he started loss of interest which activity
sir going out with his friends playing cricket with them and talking to his family members sir पहले वो बहुत actively interact करते थे family members
so family members see positive and negative can be present not about it but generally talk about people and generally matching problems to work and whatever they were you are doing and then not talking to them is decrease social interaction. Just this cannot be loss of interest related to unless you clearly mention that you should spend a lot of time in gossiping and spending that with neighbors talking about various issues and then you should stop doing that and stop. We must by means his law of has to be approved by the patient.
because his winter vacation was going on since December. So most of the time he used to stay at home or he used to play out with his friends.
कोई बात नहीं मेरे को मैं मतलब मेरे को कोई है मेरे को ऑटोमेटिक प्रॉब्लम है पेट में बाहर नहीं है टांग में दर्द है तो क्या लॉस ऑफ इंटरेस्ट थोड़ा ना मतलब अंदर से पेशेंट नहीं है ना जब ऐसा करने के इसमें भी ना पेशेंट का वो होना चाहिए कि हां बना मेरे को बाहर जाना है तो कंटिन्यू only और ये एक पासिंग लाइन आइसोलेशन को बैकअप नहीं करना है नहीं कर सकते ये लॉस it is pleasure activity. That's why I'm वो तुम्हारी जो एजुकेशन इंस्टीट्यूट का उससे नहीं जाने चाहिए ना he used to go out with me that is not paid. Then when one is the patient, he tells me that he no longer this is no longer does. Then on बस इतना ही बोलना है ये safety से बात करना है उतना उठा के नहीं सकते ये लॉस अंडर भी कर रहे हैं दैट द मैनेजमेंट भी कर रहा है when it should be done but not so that the step okay
In the morning, when he reported that he used to feel very, he never used to feel pressure and fatigue. And he said earlier he used to go out to play with his friends early in the morning, but he stopped doing that.
is there what is happening काम कुछ नहीं कर रहा मल्टीपल करना पहले तो सेम करता कीवर्ड वजह से कोई नहीं कर पाता यू कैन मेंशन दैट and what about the difference that this is important relation so but the difference of the 90 of this
So they can be some panic attack, but it is written in ICD if we are making diagnosis of depression, then we cannot another diagnosis.
Panic disorder in this way. Panic attack for the panic disorder is the diagnosis, panic attack. ICD.
Sir, ICD table.
अगर डिप्रेशन है तो पैनिक डिसऑर्डर का डायग्नोसिस नहीं it is this mention in case ऐसा है कि that can be explained by depression अगर in case that's what मेरे को भी सारी एक वर्ड तो वर्ड नहीं आ रहा so that this is the rigidity will also be expected depend आप देखो आप ऑप्शन बताओ absolute rigidity will also be explained by depression आपका कुछ वर्ड्स को ओवरडाइलेशन है इसके अलावा आगे कुछ ऐसे नहीं कि मतलब कुछ वर्ड्स से जैसे कि डिसऑर्डर
So dissociation.
आपने रखा है
नहीं sir.
कोई डिफरेंशियल लेवल पे आता है
So what is the perfect or getting into the pediatric department? What's the name?
Sir, shortness of breath.
Shortness of breath का हो गया.
Sir, cough and shortness of breath.
नहीं, shortness of breath से आपको इसलिए
Yes, sir.
आपकी बात क्या था?
Sir, अब की बार में सर ये था.
Shortness of breath.
आप
Yes, sir. Sir, cough थोड़ा कफ से स्टार्ट हुआ था और सर फिर फॉलोड बाय शॉर्टनेस
Cough and shortness.
यस
मतलब 8 weeks is the part.
सर
Yes.
Panic attacks will be secondary attacks with the problem, particularly when
Possible
से
more.
अगर पैनिक अटैक पहले से हो रहे हैं आप सारे टेस्ट में तो लेकिन अगर प्रीडोमिनेंटली जो पैनिक अटैक है वो डिप्रेशन में पार्ट ले रहे हैं और डिप्रेशन ज्यादा कॉन्सेप्ट हुआ है और उसी वजह से उसको
Panic disorder is classified between both MDD with panic attacks.
past episodes आप वो इस was that also depressive episode
No, sir, that was not a depression. So that was a panic attack.
एक episode
Yes, sir.
Can you make panic disorder with single episode?
Yes.
You sure you can attack stimulus? Plus. If there is something maybe in this. This is
avoidance from
there is late regulation in 1 month, it is for the second day.
what else can we get it other than your disabilities can it be for anything else what else you like to consider is roll करोगे ना इधर फॉरेस्ट करेंगे
Yes.
ठीक है और कुछ करेंगे शॉर्टनेस ऑफ ब्रेथ के साथ अगर और क्या करेंगे तो साइकेट्री का वो नहीं है कंसीडर करना पड़ेगा क्या है एलिजिबिलिटी होगी फोड़ नहीं सकते हैं एलिजिबिलिटी होगी डिप्रेशन का पार्ट डिप्रेशन एलिजिबिलिटी है कौन है इट कैन नॉट एक्सपेक्ट बट इट इज यू हैव मेडिकल अल्टीमेटली बट स्टेट नो अगर तुम्हें नहीं पता या दैट नहीं पता
Sir, upper and lower. Yes, sir. उनके फादर ने रिपोर्ट किया.
कैसे असेस करोगे वो चल रहा नहीं चल रहा लॉजिक में तुमने कैसे एक्सप्लोर किया वो एक फादर की वीडियो मेंशन किया ठीक है सो व्हेन द रिलेटेड वी नीड टू क्लैरिफाई मोर वी नीड टू एक्सप्लेन कि हां मैंने क्लैरिफाई कर लिया जैसे तुमने 15 मिनट बोला हो गया 15 मिनट का ड्यूटी पेशेंट को आता है कि ये तो व्यक्ति एक सीजन में 1 घंटे से ही हो रहे हैं और एक्चुअली वो लास्ट 2 सेकंड्स में भी पेपर है 2 मिनट्स उसके बाद का पीरियड तो प्री इंटरवल पॉसिबल पीरियड होता है इनका मतलब है हमेशा से एक्टिव मतलब एक्टिविटी होता है कि जब आपको पहले से टाइप करना पड़ेगा पहले क्या करना है टाइम कितना है ऐसे मतलब एपिसोड की इसी तरह रिलेटेड कैसे करोगे पैरामेडिक आपको कैसे पढ़ा कैसे एक्सपेक्ट करोगे पैरामेडिक
सर मैंने उनसे पूछा था उन्होंने कहा था कि हाँ जैसे
क्या उनको तो डिफरेंशिएट करोगे तुम मतलब अगर ऐसे आर्गुमेंट और अगर उसमें मतलब आप लोअर रिलेटिव्स पता नहीं पड़ेगा अगर लोअर रिक्वायरमेंट दोनों का सारा टर्म में सब देन तो सिस्टम यू विल कंसीडर समथिंग एल्स लेकिन जैसे उसकी फिगर्स टर्न थी ऐसे तो डेफिनेटली टिपिकल ऑफ मस्ट प्रोवाइड को बहुत ज्यादा लगता है और सेकेंडरी को और मतलब कॉलेज मेडिकल but वो लोग भी नहीं करना है बस क्लियर हो जाएंगे तो ऐसे को तो बता रहे हैं इसे स्टार्ट नहीं ठीक है मुझे तो माइक्रोवेंटिलेशन तो फिर तो बहुत और वो देख रहे हैं I'm very not like that. You know, now बार उसका मेनिंजाइटिस का
क्या होता है?
ब्रश का दिया हुआ टेक्निक होती है शुरू मसल में होती है शुरू पार्ट क्या होता है पार्ट क्या होता है सिर्फ चार तो वो पता होना चाहिए क्यों रीजन होती है और हाउ पेपर का How much practice are required to diagnose severe depression? How much major unmet
Say three typical features.
major typical typical वो है minor practice है वो भी typical तो आपको एक depression की कुछ अलग है
Three major and four minors.
और minor
For severe.
Yes.
और ये आइसोलेशन हो रहा है मॉडरेट के लिए कितने मेजर कितने माइनर
Sir, two are major and three minor.
तो डाउट का डायग्नोसिस होता है लेकिन किसी होगा ऊपर का सेल करे बताओ क्या है बायोलॉजी में क्या इसका आपके हमने टेंशन ये तो पार्ट है फाइंडिंग which he doesn't have at least from his state from biology लेकर डिप्रेशन कैन बी डिफरेंशियल यू कैन पुट द बिगेस्ट रिस्क ऑफ ओके डिप्रेशन अगर उसने इसके लिस्ट किया और आपके पास nice see there is a way era depression bipolar depression but that unless for diagnosis नहीं consider होता कभी भी unless you have a to bipolar or negative only thing we do mention there are some where we have to be careful that this can be first and third or bipolar but the treatment and diagnosis will be on the lines of depression okay never the diagnosis of bipolar treatment unless we have a diagnosis उसमें ये दिया लिखा है कि आपका सिम्पटम में इंडिकेट होते हैं बायोलॉजिकल डिप्रेशन इंडिकेट होते हैं अब आपने ये बोलिए वो क्या इंडिकेट है बताना पड़ेगा ठीक है तो क्या इंडिकेट होते हैं ये बिफोर डिप्रेशन बायोलॉजिकल डिप्रेशन बट एनीवे स्टिल द ट्रीटमेंट लाइन एंड डायग्नोसिस इज ऑलवेज डिप्रेशन वो तो आपको हवा में मारने की है हो गया बायोलॉजिकल हो गया only thing you can do is be careful that is you need to be if you consider if you have anything this you want to say this is bipolar but आपकी ट्रीटमेंट लाइन कभी भी बायोलॉजी नहीं ठीक है तुम बिल्कुल ये वाला उसमें बात कर रही हो बुक्स में यही है कि आपको केयरफुल करना है इसके अलावा आप अपने आप से बायोलॉजी कर और नाउ सेलेक्ट ट्रीटमेंट योर ट्रीटिंग दैट इज द वेरी ऑफ लेवल अनलाइक what the diagnosis of understanding started after the studying after some device.
Yes.
Friends problems.
In fact, even his father was saying that the son, like, his friend was not that much bigger. Like he was like, he went there, he started having a lot.
It's not significant as well.
First name, but I think grandfather passed. First name is what came out.
Yes, grandfather's job also.
Before the first name was also.
Then his friend's father.
No, Fred's father is in this episode.
Yes.
4 years earlier, that episode was.
Yes.
CPP stress at that time. His grandfather and father. Grandfather is his sister.
And this is 1 week prior to admission, someone in his neighborhood died. After which episode, some.
क्या हो गया?
Antidepressant.
क्या पेशेंट एज क्या है?
70.
बैड और severe में तो always pharmacotherapy is indicated. So you are not wrong that way, but in child and adolescent, you have to consider not to be one.
And this is the food for child depression.
So,
And नहीं होता है तो पहले यही ये चीजें तो चेक करो ठीक है मैं बता रहा हूँ ये नाम है तो ये इन्होंने गेट लेके चले तो काम करना सीरियस इंसीडियर होता है तो फिर भी क्यों होगा एक्टिव होता है क्यों
नहीं पर तुम्हारा कॉन्सेप्ट तो
पहले तो इन्होंने हिस्ट्री में गाना में करे बैठी कॉन्सेप्ट कॉन्सेप्ट ज्यादा जब हॉस्पिटल में आया
हाँ